I will defer to Senator Blunt Rochester.
Thank you, Mr. Chairman. While I agree this is a vitally important topic, our U.S. biotechnology is critical. Even in the state of Delaware, this is a big focus for us. Delivering life-saving cures, that's the bottom line. I'm concerned that this moment is kind of overshadowing this really critical conversation that we're having here. Right now, as I sat here, I saw that the window shopping period for healthcare.gov has opened up, and families right now are opening this website and seeing sticker shock for so many of them. I was literally, I'm sorry, I missed some of your testimony because I was on the phone with people in my state, whether they are from community centers, whether they are government officials. Our food bank is coming in later. One of our community centers said they literally ran out of food yesterday, and this is before we make choices with what happens with the SNAP program, things that make us healthy, eating good, healthy food. And so to the witnesses, I thank you for your testimony. I am looking forward to a real robust conversation on how to make sure that our country is strong, both our health, our national security, our agriculture, because biotechnology is really connected to all of that. Dr. Ramachandran, I want to start with you. With the president just leaving China, I think it's important to highlight that China is closing the innovation gap by strategically investing in biotechnology. In 2021, China released their 14th five-year plan, which laid out a whole-of-government blueprint to becoming a global leader in biotech. It is one of their strategic priorities as a country for healthcare, for agriculture, and for energy. Can you highlight a few of the specific priorities in that five-year plan?
Thank you, Senator, for the question. And you're absolutely right. In that plan, China made very strategic, targeted investments at every point of drug development, manufacturing, and delivery in order to enhance their role in our global biomedicine system, biomedical research system. In particular, for R&D, like the early stage research, what NIH typically funds, they wanted to hit a target of 7% annual increases over the five-year period, and actually have far exceeded that over time. They've also put in several grants in not just for early stage research, for clinical trials, to be able to have operations that would host clinical trials for companies that are based in other countries as well, and also prioritizing domestic pharmaceutical companies and domestic manufacturing. A lot of public investment that went to prop up small biotech that's in China, as well as manufacturing facilities. So really at every stage of the pipeline, China decided to put in a lot of investment, and we're seeing returns from that. They're obviously now a key player in terms of medicines that we have here. About a third of medicines that are new in the United States come from China, at least the products. And on top of that, generic medicines, obviously, several of them come from China as well. So they've positioned themselves to be a key global player, not just for themselves, but also the rest of the world in terms of biotechnical innovation.
I have a question for the panel, and it's just a yes or no. Have you seen in our country a comprehensive plan that's as strategic as this one in biotechnology for this country? Just yes or no?
No, Senator.
No?
No.
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 Thank you. That answer is because we don't have one. And I think watching and I'm just going to run down the cuts in research right now, the lack of focus on clinical trials and pulling away, getting rid of scientists and cuts to our institutions, our academic institutions, the talent pool that we need, the workforce, and shuttering agencies and getting rid of grants. I don't think that's a recipe for us to be a global leader in biotechnology. Do you? Anybody? Again, thank you, Mr. Chairman, for this very important hearing, and I am really looking forward to continuing this dialogue because this is vital for our health, our national security, really for the world. I like what you said, Mr. Crowley. I don't mind if China makes our toys. I don't want them making our medicines. Thank you. I yield back.